Okay, A to Z of emergency medicine. This is the grand finale. Z is for Zyprexa. And general rule from pharmacy perspective, we never talk about drugs and brand name. Zyprexa is olanzapine. And as far as generics go, there's another second generation antipsychotic, ziprasidone, that you're thinking, well, if you don't ever talk in generics, why didn't you use ziprasidone? Because that's the generic name for Geodon, and it's also a second generation antipsychotic. But I want you to focus on Zyprexa because it is, even though that is the brand name and that's a rule of thumb for pharmacists, Zyprexa has way less side effects when used for agitation and delirium, psychosis in the emergency department. And so Zyprexa, even though it doesn't meet my standard for a Z that is a generic, it is definitely the drug of choice as far as second generation antipsychotics. The concern that we have with second generation antipsychotics, two things: QT prolongation and hypotension. QT prolongation, especially for patients that are on any slew of other medications. We've already talked about QT prolongation when we talked about Q, but any of those other medications that might cause QT prolongation, along with a second generation or first generation antipsychotic, can absolutely make that worse. And Geodon, or ziprasidone, actually is the worst of all of the second generation antipsychotics with relation to worsening QT prolongation. Zyprexa, or olanzapine, has very little QT prolongation risk when given alone, or when given even with all of the other QT prolonging meds that patients might take at home. Hypotension is our other concern, and olanzapine does have some hypotension risk, but when we use it in reasonable doses, that's why we start low, like in a 10 milligram dose, versus like starting with a 20 milligram dose, IM or IV. We really have less hypotension than even with some of the others, and especially when you're considering what your alternatives are, like benzodiazepines, which can absolutely cause hypotension. So I chose Zyprexa for Z over ziprasidone, which is Geodon, because Zyprexa really would be my second generation antipsychotic drug of choice if I had to pick one. The other thing to consider is all of the first and second generation antipsychotics have a black box warning for use in the elderly. The black box warning is very vague, and there's really no reason that they can link these two together, but the black box warning is an increase in mortality when used for delirium. And that mortality isn't necessarily acute, but over the next, I can't remember, 60 to 90 days, increased all-cause mortality. And so it should be used with caution in patients over 65. But again, Z is for Zyprexa, and when you use it, when you're picking, as it relates to all of the second generation antipsychotics, Geodon being another option, Zyprexa or olanzapine has way less concern for QT prolongation and has just a moderate risk for hypotension, especially again when compared to benzodiazepines. So there you go, wrap up A to Z of emergency medicine with Z is for Zyprexa.